think we must move on. There's interest of time. Mehmet is going to give his comments while he's giving the talk. So Mehmet, off you go.
Are fine, and this is my talk. Actually, this talk on the philosophy of spinal implants. Do you hear me?
Yes.
Yeah. Okay. Philosophy of spinal implants was prepared mainly by Dr. Ali İhsan Ökten, a Turkish colleague. He is also a neurosurgeon and doing mostly spine surgery. I have to translate it to English, and then he wanted me to give the talk. I will give another point of view on what are we doing currently in spine surgery. Is it correct or not? It depends on your decision at the end. As we know, philosophy and medicine are different disciplines, but in the beginning of the civilizations, the all old physicians were being interested in both of them, and it is conjugated in general because they are dealing with the human and life problems. However, the Enlightenment, which started with the Renaissance, have brought the modern medicine, and by the beginning of modern medicine, the separation of medicine and philosophy has started. This separation shifted to scientific and shifted to a more scientific and technologically focused field, and the specialization has become a necessity. So then it was the start of a fragmented medicine. There was a shift from holistic medicine to fragmented medicine. It was specialization was necessary. Even the sub branches were created. Like today, we can specialize spine as a branch, but then spinal deformity is another sub branch. The biggest problem today is the increasing specialization and the fact that they work without knowing each other. In 21st century robotic era, the industrial medicine has started. This process in which medicine and philosophy fell apart in the previous centuries continues more and more. Unfortunately, the age we live in is a mechanical age, and medicine has now become mechanized. As we know from the modern medicine, we remember the civilizations with the imagination about ages. And this was an aesthetic perception. Like we know old Egyptian civilization from the pyramids, and then we also know the ancient Greece with its temples. Man of the modern age, however, became a Homo economicus. And the wording, I think, therefore I am, has evolved to say I consume, therefore I am. This example is from my own country. This lady had a surgery before, and now she came with new onset leg pain, and leg pain was more than back pain. You can see probably the first surgery was at L5S1 level. You can see small compression probably, even if I am not sure for that. on the L5S1 level. And such a surgery with 6 levels of fixation has been done with no benefit to patient. Spine surgery in 21st century, how will this century be mentioned in the future? The wording will be, I screw, therefore I am. This box is a reflection of a removed implants of a spine surgeon. And is it the surrealist painter Frida Kahlo, who had polio disease and had a serious trauma to her spine, had got multiple surgeries in 1950s, and has kept in a whole body brace for 5 months and has depicted pictures like this on the left with a big column on the spine supporting her head from to the spine. If Frida Kahlo lived today, would it be like this picture on the right? Is our body a construction site? We can ask that question. And this is a construction. The aim is strengthening the columns. Yes, in deformity surgeries, we can have similarities with construction. But another question is that man's search for a new existence, is it a consumption? And spinal surgery as a cast for existence implants. The French philosopher Bourdieu mentions 2 types of capital. One is the economic, the other one is cultural. Cultural capital is with education. Education also enables high culture and high consumption that is an integral part of it. And we have the reasons for spinal surgery, as said by the Bourdieu. The neurosurgery community has directed neurosurgeons towards the spine with mostly unjustified statements, such as we should take care of the spine now, and we should take it back from orthopedic surgeons. And the spinal surgery has become a very attractive discipline, and then it increased in different stages. What is the relation with the consumption and aesthetics? The aesthetics is a very indispensable part of the consumer society. There is a very important relation between aesthetic and consumption that plays the wheels of the consumer society. And under the name of design differences, we are also applying aesthetic in our spinal surgery. In the continuous flow of bundles of goods, design is presented as a concept that serves the wishes of the consumer. And now we are forced to use differently designed products in each surgery. We are still changing our designs of implants. Somebody says that if you consume more, if you are able to consume more, you are more freedom. You are having more freedom. However, it can be easily noticed that a paradoxical situation emerges with the consumption and freedom. In fact, aestheticization and design efforts, which are presented as a way to liberation, ultimately become restrictive of freedom. So, what is the end of consumption? The statement is that the consumer society balances on consumption and the condemnation of consumption. There is no doubt that spine fusion stabilization and implant surgery are indicated and very effective in some patients. However, the significant increase in the indications of this type of surgery, the high financial burden, as already mentioned by other speakers, the increase in complication rates, and the increase in the reoperation rates bring to mind that some of the spine fusion surgery is not necessary or without indications. What are we doing? The question must be this. Industrial medicine consequences are medicine is removed from its humanistic roots, physicians are transformed into technicians, and the holistic approach to the patient is lost. We doctors need to stay away from this or question it. And we must apply humanistic medicine. The implant is an invention of industrial medicine. It has some benefits in cases where it is indicated. However, implant use without indication is close to becoming a social problem. And how to avoid the unnecessary usage of surgery or implants? Remember, operate the patients, not the films. Remember, some degenerative diseases cure spontaneously. Make a proper patient evaluation by doing a good pain evaluation. Consider patient psychology, unrealistic expectations, or environmental problems. Change the training programs and focus more on. Do not focus more on surgical techniques, but the patient selection. So it's time to add a new spirit and philosophy to medical sciences. We have that line, holistic medicine, modern fragmented medicine, now industrial medicine. We must turn back to humanistic medicine. And implant overuse is similar to overconsumption. And I want to finish this talk on philosophy of spinal surgery with the poem of Miss Emily Dickinson. Surgeons must be very careful when they take the knife. Underneath their fine incisions stirs the culprit, the life. Thank you for listening to me.
Thank you, Mehmet. I think awesome talk as always. I think all the talks have been brilliant, and it's mind-boggling. I think what you have gone through is actually what we feel every day. When we see patients every day and they've gone through surgeries, etc., and a lot of issues, and then we just wonder, are we doing the right thing? Are we training people enough? And how we should improve to sort all this out. I think I'd let Andreas to take it from here and tell us how do we move forward. Mehmet has given us suggestions.
Thank you, Salman, and congratulations, Mehmet. It's always refreshing to see talks that take well, we often use the term helicopter view, but this is much more than that. It's, you know, the philosophical treatise of where we're going and how we evolved. So great. Well, congratulations. I think it will take a lot of effort to try and find answers to your questions. There's a lot of competing factors and conflicts of interest in our day-to-day work, which we need to resist. But yes, this is a very, very thought-provoking presentation. Congratulations to both Mehmet as well as the co-author of it. Thank you.
Wilco, what do you say about that?
Well, Mehmet, I was jealous on your talk. This is how it should work, and hopefully, when we have a physical meeting during the World Congress of Neurosurgery, there might be a session about the philosophy of our spinal implants. What I like very much is very thoughtful, and also the way we should think. So maybe challenge you and Salman to organize something during the next World Congress about this, because that might be very it is very thoughtful and also nice to see it. Thank you, Mehmet, that you did this very good presentation together with your colleague, because this is the way we should proceed.
I think
I enjoyed
Wilco,
it.
excellent idea, Wilco. I think we'll definitely do that, and I'm sure you and Andres will be a part of that whatever we did, and we'll get suggestions from you. Sandeep?
Yeah, I think it was a brilliant session, and everybody enjoyed it. And I think we can wrap it up now if there are no questions.
Yeah, thanks a lot to all the speakers. Actually, we digged a bit to ask backward what we are doing currently and to criticize ourselves, not the others. And actually, we should proceed with more philosophy, not just what the industry are trying to implement. Thanks.
Okay, good. So let's wrap up, and thank you, everybody. And as always, Mehmet, great job. I think Wilco, Andreas, all our other friends have done a brilliant job. I was also listening to the craniopharyngioma, and that was so cool as well. So guys, we'll meet again, and hopefully we'll get more stuff for you. Thank you, Wilco. Thank you, Andreas.
Bye-bye.
Thank you, everybody.
Happy Christmas,
Bye-bye.
everyone.
Okay,
Bye.
bye-bye.
Holiday.
All the best.
Okay, take care. Bye.
Goodbye. Goodbye, everybody.